Hey, Facebook. I guess tonight I'm coming to you live to do pre-debate coverage. I'm sure many of you are planning on watching night 2 of the Democratic presidential debates, which I'm going to do in a few minutes. But I wanted just to quickly update you on a few things that happened this week. Mostly I'm in district again, but I did spend a couple days in Hartford. So it's a combination of meetings there and getting back in touch with a lot of organizations and people in the district, and sometimes those things overlap in really interesting ways. So, as I mentioned last week, on Saturday I got to go to the Great Country Mutt Show with my dog Nellie, which was really fun, and a fundraiser for the Kent Library. As a side note to that, I've discovered yet again that I'm really horrible at remembering to take pictures at these things. So often during the campaign, I had the great benefit of having people around me who would remind me, take pictures, but I kind of hate showing up at events and taking a selfie, and or thinking about first capturing the moment. So I know that gets me in trouble with Facebook, but I'd rather be talking to people. So I'll try to improve that, but I'm afraid it's a character flaw. On Monday, I had a couple of interesting meetings. One focusing on trying to help students in the Torrington area who are trying to access vocational and VOAG, vocational and technical agricultural education, and trying to sort of balance the needs of individual school districts and essentially other types of schools. And it's a challenging situation, and kids hopefully have some choices, but we have to make sure that their needs are taken care of, in addition to taking care of the school districts, which are helping all public schools, which are helping all of the kids. So complicated situation, but the good news is that I think our entire regional delegation is united in trying to solve these problems in a really practical way. So that was really rewarding to be part of that group. Also had a meeting of the Litchfield Opiate Task Force convened a meeting in light of some opiate deaths recently. And trying to bring together a lot of resources and people who deal with those who have opiate, who are dealing with addiction in various ways. And it was actually a really practical meeting of people who deal with a lot of different situations in the region. And in particular, given that I was off the next day to tour Garner Corrections, which handles it focuses on inmates in Connecticut that have significant mental health issues, and there is often in that community, as in other communities in our correctional facilities, substance abuse issues. And so helping that formerly incarcerated population be assured that they have those needs taken care of when they emerge back into the community is a really important issue. And we did in Judiciary this year work on a lot of those issues of the formerly incarcerated, but ensuring that they have, when they return to a community, even if they've been relatively clean while in custody, when they return to the community, it can be quite stressful. And we have to make their transition, if they're on medically assisted treatment, that transition is smooth, but also that we connect them to resources in the community so that they can be successful and integrate back in a positive way. And I think there's lots we can do there, and there's certainly a lot of resources and a lot of interesting ideas in the room about how to work together for that. So having those two meetings in close proximity was really interesting. Then on Wednesday, I attended my first State Bond Commission meeting, at which the first series of state bonds were approved, and we in the region had two. One was for Kent Affordable Housing, which got a grant, which was very exciting because that's a fantastic project, and I'm really happy that we were able to get that over the finish line. And we also had a grant for the Litchfield County Regional Fire School for some soil remediation. So was very happy to see the Northwest Corner featured in the first bond package. And today I had sort of a couple of personal meetings. One, we had actually a meeting in Sharon focused on Sharon Hospital, and in particular the Certificate of Need process. And my apologies again for repeating a jargon-laden conversation, but this was an initiative by the Office of Health Strategy, which monitors the CON process, and CON stands for Certificate of Need, and that's what any healthcare institution in the state, if they want to essentially any major change, which includes closing down major services or mergers, change of ownership, anything like that, they have to apply for a certificate of need, and the state has to approve that transaction. And so our local hospital, Sharon Hospital, has one of those. Has various ones, but the most recent one was in connection to a merger between their current ownership, HealthQuest, and Western Connecticut Network. And so there's a certificate of need which has a series of commitments to the community about how this nonprofit entity, which has owes certain obligations to the community, is going to fulfill those obligations. And so OHS, in order to make that that process, the CON process, more transparent and more usable by the community, has started a series of meetings with the community so that communities can learn how to use, how to enforce the commitments in those certificates of need. And tonight they gave, I think, their inaugural presentation, and I believe this is something that they're going to start to do throughout the state. And it was a good first meeting. I think everyone in our community understands that we need to remain committed to our regional hospital and see how it goes, but I believe there are a lot of people in the room that are prepared to be vigilant as we move forward. So I think that was a good meeting. And then tonight, on my personal level, I have been for many years on the board of Women's Support Services, which is a domestic violence agency, which is part of a network of domestic violence agencies in the state of Connecticut. And tonight I hit my term limit, so it was my final meeting with a great organization, and actually also one of my entrees into the meeting many people in our region who volunteer for or serve on with nonprofit agencies in various capacities, and they come off one and they go to work for another, and we are really blessed with a great community of people who are dedicated to those nonprofits which do tremendous work in our community. So I will remain committed to that agency for the rest of my life, I believe, but I no longer have a seat at the board, so I'll have to find other ways to communicate. But it's been great to be involved with them. So enjoy the debates tonight, and talk to you next week. Bye.